can focus on the semis. So if you just bend that leg, just hold opposite, so semis there. Yeah. So we're going to focus on the semis, coming up and then the bicep femoris. So just relax there. So the technique, yeah, I quite like to use is this one here. Yeah, so like the knuckles one we've done on the back and things like that. So from there, I'm just going to lock in. Sometimes I'll put my hand on there just to stabilise. I'm just slowly going to work up to start with. Okay, so I can just work up the semis there. Pressure okay?
Mm-hmm.
You're working through. And I'll probably do that once or twice. Yeah, as you know, as a sort of like a routine. Yeah, that sort of thing. And I'll probably do the same, drifting from the lateral side. Yeah, come up there. Art Riggs has some nice videos on YouTube where he does a lot of it dry. Yeah, so he has quite a nice one. He has a nice one for the hamstring. I'll show you that in a sec. But he has one for the IT band. Yeah, where he's literally with a thumb and finger feels is it. So if you find the IT band and he's pulling and pushing to see which part is being restricted, and if it's stuck going that way, you'll work into it using like a reinforced finger I'm showing you. Yeah, or if he pulls it towards me, you work above it. I can show you that in a sec. So you can work this way, yeah, up and down. It's also quite nice to work from you know, origin insertion, whichever way you want to look at it, or proximal to distal, yeah, coming down through that. But quite soon I'm going to do some movement, yeah, as in the patient's going to start to actively do some movement, so we'll do that now. So from there, so what I'd like you to do, yeah, is from this position, is just simply straighten the leg. You okay?
Mm-hmm.
Yeah, so from there, just lean in it, slowly, slowly. Yeah. Just going to change my angle now, coming through. Okay, once she touches, bring your leg back up, and off you go again. I'm working through. Okay, so that's using the knuckles, so from there, yeah, you might find this slightly awkward, this position here, because I have to come through, yeah, into that. So I'm on a semi, normally the tendon shows itself there, so you almost have to push that down a little bit. Yeah, so from there, now when you're ready, off you go. So you're going to work through, yeah, this way. If you do like a James Earl's course, they do a similar technique on the foot. Yeah, but it doesn't matter what's wrong with you, probably start on your foot, yeah, and then work into Achilles to the gastrocs, hamstring on the ipsilateral side. And that's the superficial back line, the retreat on that one. Yeah, then you can do the same. Yeah, so I probably would prefer, yeah, this way, yeah, and working down through that. Is that okay?
Mm-hmm.
Working through that. Okay, so that's using the knuckle. If you want to use the thumbs, you can, but be careful. You know, you might find every time you work and you think, every time you're crossing is like, oh, it's, you know, you'll feel it yourself as a little tender point. Yeah, so you might say, well, if it's a particularly tender point, you might want to just maybe lock into that tissue now. So let's say there's a bicep femoris sort of mid-belly area. So just hold your leg in that position. So if I was to come in with one thumb and lock in with one thumb, now if I lock in and just keep it locked in, now slowly straighten your leg, not going to feel much yet until you're midway on the straightening. But you're quite flexible anyway, so just a bit there, you can feel it, just there. Yeah, so then maybe start there. So what I'm going to change the angle now. So from this, now as I lock in when you're ready, yeah, so from there, I'm just going to just drag my thumb, if you like, towards the ischial tuberosity, like so. Yeah, if you find the lesion is there and just above, you can lock in when you're ready and go towards the insertion. Okay, within that sort of area there. Okay, so you can focus. If you wanted to, you can use the fingertips like I've shown you. You can reinforce the fingers. Yeah, there's a quite nice technique in between. So you got the semi, yeah, and then you got the bicep femoris. So you're almost going in between, yeah, in between the muscles in here. Yeah, so you could use a thumb to glide, yeah, that sort of thing through there, or you can use a reinforced finger in between the sort of septum. Yeah, that sort of thing in there. Yeah, but I probably would have it. There it is there. So hold your leg. Yeah, so now, and you probably find you can go through this when you're ready. Off you go. So you're trying to go like into muscular septum, that, yeah, in between. You okay with that?
Mm-hmm.
If you want to, I quite like the pressure. Yeah, bring your leg up. Yeah, and then just lean. Well, the couch is a bit low, but you know, you can adapt quite well to the low couch, I think, if you drop down. How's that there?
Yeah, fine.
So you can obviously use more pressure, but because there's a wider surface area, it actually feels more comfortable. Yeah.